So thank you to all the participants. So I see that we're right now 41, and this is the very last session of the NTA conference, the virtual conference. And thank you for staying. What I have to say is that we all know why we are here, and we are unfortunately not at the East West Center, and it's because of the COVID-19 crisis. So this session is focusing exactly on the generational perspective on economic crisis caused by the COVID-19, and I would like the presenter to stick to the 10 minutes because this is completely new for all of us. We are no experts on this, so we are still learning. So the more debate we have, the better, probably for all of us, in order to improve our models. So the first presenter is Professor Batslul, and he will present the impact assessment of COVID-19 on generational accounts and application of integration of NTA and economic-wide model. So Professor Batslul, please.
Thank you, Miguel, and good. Hi everyone. I think it's all over the world, so I will not say good morning or good afternoon. Let me try to upload my presentation. Can you see the presentation, please?
Yes.
Okay. So I think this is an experiment that we have ventured into. As Miguel was saying, this is a gray area still, and this is a very much work in progress. And we thought that when I'm basically new to the NTA network compared to the others who have been working there for 20 years. We are a new group, but when I joined the network, I thought that there is a possibility that we could actually, combine these two methodologies, like the methodology of, the economic modeling, and also like the NTA, because the root of these two models are basically national accounts and consistency of the national accounts, and so it's possible to do that. And while we are doing this, using this impact, economic modeling for impact analysis, I thought that we can also extend it to see the impacts on the generational economy. With that, I think we have 4 parts of this presentation as basically briefly context, methodology, and data, and then I will talk briefly about the situation in Bangladesh before COVID-19, and then the impacts on COVID-19. And in the conclusion, I like to say also that what is our next step and how does it look like the next step? And we will come back with the next step presentation as well. So, okay. The motivation, as I said, we all know about the COVID-19 has exerted tremendous impact on social and economic life on everyone. Nobody is spared actually in that way. And the cost of this impact has been estimated by several agencies, including World Bank, IMF, you can name everyone, and the governments are also doing that. But I think the focus was mainly using very well accepted economic modeling like computable general equilibrium model or regional input output models, what Asian development has done for Asian countries. And they're seeing it mainly from the macro and also sectoral perspective, looking into which sector it is impacting more, and also the impacts on employment and poverty level. But they basically stopped there. I haven't seen any extension of that one to see in terms of age cohort or the generational economy in that perspective. So we thought that there is a possibility that we can combine these two methods and try to see that, try to extend our analysis beyond the macro sector and try to see from the generational perspective. So that is the motivation. So when we combine this one, I thought this will look like this one. Instead of presenting like algebraic codes, I thought that, okay, we can possibly better represent with these graphs. On the left-hand side, we have this very standard economic modeling. It could be social accounting matrix, and it could be computable general equilibrium model. It could be static, it could be also dynamic also. At this point, we are using a static 2020 static CG model. And it covers basically your income generation, household income, jobs and poverty. So we link that with other two models like the employment module and the poverty module to find out the impacts on macro growth, household income, jobs, and also poverty. And then we also, in this way, we can actually, find out what would be the impact on, like the export laws, remittance laws, lockdown of 12 weeks or 8 weeks. So from the supply side as well as from the demand side. And you can extend this kind of shock into this city model. And then also you can try to find out, like most of the government has also announced a lot of stimulus, and including Bangladesh government. So we can try to find out what are the impacts of the stimulus, and they try to, do a different types of stimulus, and to show government that, hey, possibly this way you can have better impact. If you consider sector, macro, and generational perspective. And on the right-hand side, we have the very well-known generational economy component, which are very well-known to this group. So I will not spend much time on that one. This is also, we have also calibrated our 2016 data into 2020 NTA. So we are combining these two. On the bottom, I have given the data set that has been used for this one, which include a lot of data set, but these are mainly made with consistent with the social accounting matrix that we developed for 2022. Just to iterate that, we have used this framework for our 8-5-year plan, which will start in July of this year. So some of this analysis actually went to our medium-term plan also. Okay. Now, before COVID-19, like the picture was very rosy in Bangladesh. It was one of the fastest growing economy in the world, and the growth rate, according to the official statistics, was supposed to be 8.2%. Unemployment is very low, as we measure unemployment in a different way, not the way the OECD countries and developed countries are measured. So we have surveys, 3-4 years surveys, and then we found out that, and we follow the ILO methodology, and then unemployment rate is very, very low, always 3.7%, although underemployment is quite high. The poverty reduction has been good because of the growth effect, and we are supposed to, in 2020, 19% moderate poverty, and extreme poverty 9.4%. And according to the projection, we are on course to actually reduce, meet the zero target of extreme poverty by 2030. Okay. But then I think there are several challenges like any economy, but I highlighted only, basically two challenges, and which are also linked to the previous discussion that we have over this week, is that the inequality is rising in Bangladesh despite growth and poverty reduction. And it's very high. This is consumption Gini. And if you see that between 95 and 2016, it's really remained, 32%, something like that. And income Gini is even higher. The gap between income Gini and the consumption Gini is 16 percentage points. And it's hurting. We know that, if the Gini is above 0.27, it will hurt, growth following IMF working paper 2017. And also they're trying to find out, like for the first time in the case of Bangladesh, what is the level of, the life cycle deficit of two groups, like the elderly and the children, and how are these supported? And you see that, obviously because of the large young cohort, the life cycle deficit of children are much higher than the elderly, but it's growing. All of these are growing. The worrying part is that these are growing. And you can see that in the case of children, the support from the government is very small, and public sector support is around 11% in 2020. On the other hand, because of the public pension and the relatively wider old age allowance, social pension, the public sector support for the elderly deficit is quite, better than compared to the children. But there's this huge gap, and it shows the reliance on the private transfer to meet their consumption need. Okay. Now, then came, the COVID, and it shattered, the economy and the livelihood and life also. And then, first of all, we tried to find out, there are several simulations going around. We tried to find out, okay, important growth driver in Bangladesh is ready-made garments and remittances. And we thought that if there is a reduction in 15% RMG export and 4% reduction in remittances because of the Gulf economy contraction, and there is an 8 weeks lockdown. I mean, the lockdown is actually having higher than the 8 weeks. So what is the impact on the GDP and household income and employment? So I just flagged two impact. Like the GDP growth may drop to 1.5% from 8.2%, and the household income could drop to 13% across most of the. In this model, we have used 5 households by different age cohort, like children, school age, working age, and old age. Okay, and this is the on the right hand side. I show the whole. General economic modeling. How does it work? So on the left hand side, on the top, it is demand shock. On the bottom, it is working as the supply side shock of the lockdown. Then we take this income loss to the NTA network and they try to find out what is the impact on the generation economy. So we have 4 graphs. I mean, it's obvious. I mean, everybody can actually assume that, I mean, there will be loss of income as well as the income and consumption both will reduce.
You have 2 more minutes.
Okay, and everybody will be affected by this one. But we actually picked up 2 groups, elderly and children, and then to try to find out what would be their, deficit compared to the pre-COVID deficit. And we found that, the children and elderly deficit are widening, and it is much higher for 0 to 9 years of age and 85 years after that one. And on the bottom side, we also find out that, while on the other one hand, their deficit has increased because of COVID, but the share of government transfer has also fallen because they did not, actually come up with stimulus or try to find out to cover that gap. Okay, so these are the results. Now, what we take from this one assumption that we make is that we assume that the pre-COVID intergeneration or inter-household transfer will remain same, given that their deficits are widening. And if we don't act, also the private reliance on the private is also under threat. If we don't act, child and old mortality rate may spike. We are seeing that one. The success on the nutrition front in Bangladesh will be lost possibly, and then the productivity of the future generation will be compromised. So then it calls for a wide range of social protection transfer. And we also try to find out what kind of social protection transfer has been around the world. So given that, we surveyed that, and we found that there are 2 types. One is that you can expand horizontally, you can expand vertically, and there's a call for universal transfer basically, because everyone is affected. And it calls coming from very, very interesting agencies like IMF, World Bank is calling for a universal transfer. And then also what type, what is the share, what would be the size of the transfer? Martin Rebellion has called anything less than 2% is insufficient. So given this one, our next step will be like using, to see what kind of, stimulus in the form of social protection will help reduce the gap of the 2 elderly, 2 deficit generation directly and indirectly through the economy, and then try to find out what would be the impact on growth, employment, and poverty. With that one, I like to stop. Thank you so much.
Thank you. So the next presentation is going to be done by Professor Latif on the socioeconomic impact of COVID-19 in Senegal. Professor Latif.
Thank you. This work on socioeconomic impacts Senegal case, and we do it as a command from the government of Senegal when we are working with UNFPA. Then I will to save time, I will go directly to that's the menu background. COVID-19 socio-economic impact result on the Senegal case and the next step. Then we know that COVID-19 have a big impact on all the sector, the SDGs. This is a framework which come from UNDESA, and we are working with the NTA framework. Then we use the NTA fundamentals, NTA classic, and after we work also with national demographic division national observatories in West Africa when we are working 5 years ago to develop a composite index based on these 5 dimensions: life cycle dependency, better life, poverty, human development, and network. Then it is lucky that we have a baseline for some of the countries, now 12 countries in the last year. Then when COVID come, some of the governments asked us to have to help them have impact, social economic impact. Then we use the model already, this model which are already calibrated for some of the countries. Then for the data, we use some of the data which come from national statistics. The data which come from the Department of Planning, the data from National Program on Social Resilience, Demography Division Monitoring Index National Reports, Forecasting and Economic Studies Departments, and the task force which respond to COVID-19 at the Ministry of Higher Education, who invite us to do some studies about this, and the World Bank data. Then we work with 3 scenarios. We say optimistic scenario, medium scenario, and pessimistic scenario. And the optimistic scenario is that we suppose that the crisis will end in the first quarter. In the third quarter, the medium scenario is that the crisis lasts until the end of the third quarter, and the pessimistic scenario is that the crisis persists for 2020. Then all the results are present is we have these results 2 months ago. Then it helped our Senegal country to do his second report on how to relance the economy. Then that's the hypothesis, the table of hypotheses for each scenario. Then we take by dimension, we have a scenario on self-employment, labor income, on earnings, on consumption by age, life expectancy, fertility rates, expected duration of schooling, living standards, poverty trap, and food consumption, access to social service and infrastructure, and GDP. And for the when we do this estimation, you see, for example, in this table, the Department of Forecasting has said that in March that we will lose our GDP growth rate will be 3%, and now we are lower than 1%. And the estimates without COVID is 7% of GDP growth in Senegal. Then we are now less than 1%. Then our pessimistic scenario is now in the reality is the optimistic scenario for Senegal. Then for the result, that's in this graph you have in green, no, in black. In black, that is the baseline 2019. In green, you have the optimistic scenario, and in red, in the right, you have a pessimistic scenario, which are shown here. Then, in the optimistic scenario, is our baseline support ratio is 43.5%, and it will decrease to 42%. And in the pessimistic scenario, that is now we are around 40% of the support ratio, and our GDP is estimated at 0.34% of GDP growth per capita. Then when this decrease implies a loss of 1 we lost around 2 million jobs in the countries because all the economy is impacted by this crisis. Then that is the result on the dimensions of the Leipzig deficits. Dependency is decreased from 37 to 3%. Better life decreased by 4%. Poverty dynamics increased by 3%. Human development decreased by 3%, and access to social service decreased by 5%. And we do this work for on gender with gender lens, and you can see here that the impact on the economic dependency is very, very high. Men in Senegal are lose all of their economic powers. It's decreased from 91% to 7%. And we can see also all the difference between, for example, poverty dynamics increase for men by 4% and for women by 5%. Human development, 4% for men and 3% for women, and access to social needs is around 2% of decrease of. Then that's the big result, big picture for this impact. The result we have, we using NTA combined with composite index calibration, and now we are working to do to work at subnational level with Ministry of Economy and Planning to help the government have to target the department and the region where the impact is very high, and to do how to manage and how to put money to come at the baseline. Then that is the economy without COVID. That's what I want to show you. Then thank you very much.
Thank you, Latif. The timing even better than doing the presentation, recording the presentation. So the next speaker is Professor Langre. Please, it's your turn.
My own presentation is for the Nigerian case study after we've listened to the earlier two presentations. And it's important to note that the Nigerian situation is a lot similar to what we have heard earlier on. The first case of COVID was seen in Nigeria in February, and we know that the pandemic has created a lot of issues that has not been known before, including, and it exposes the weaknesses of the Nigerian system, the health system, the social protection and public services. And it has laid bare the interconnection between the formal and the informal sectors of the economy. And that's why it's a little bit tricky after these few years trying to understand what the implications are. But the implications are already there. The confirmed cases kept increasing, and we have the peak on July 3rd. And ever since, the figures seems to be flattening out, which is a sub-optimist view. People are still thinking that maybe it will increase. But generally in Africa, the confirmed cases are really low. Africa has close to 800,000 and very few deaths, and only less than 3% of deaths as the mortality rates. Nigeria has about 45,000 as at yesterday confirmed cases. And out of these, we have only 2.1 mortality rate. the question had been raised elsewhere, whether the low figures are as a result of low testing or that it's because the cases are actually low in Africa. Either case, these are yet to be confirmed empirically in many studies. But whether that happens or not, the implications are obvious, as been seen from the earlier presentations. And these effects are seen, as I'm going to present it, in 5 different areas. We have the effects on human capital, health and education, the effects on job, unemployment, and loss of productivity, and the firm closure, occasioned by the various lockdowns that we have had, as well as income, consumption, welfare, and poverty. The data that we use is a relatively new data because we try to look at what has happened during the period of COVID in Nigeria. And there was a data that was collected by the National Bureau of Statistics in Nigeria. This data it's a phone interview for about 4,000 households, but the usable questionnaires from those 4,000 households actually 1,950, and it covers the first 2 months of the COVID pandemic in Nigeria. We'll try as much as possible to just show some pictures of what has happened to the key variables within these 2 years, as much as allowed by the data. What we also try to do is to divide the generations into about 5 different generations. We have the children, which are about 0 to 14 years old. We have the maybe young people, 15 to 25, and we have the workers, 35 to 55. We have early retirees, 55 to 64, and retirees. So that's the way we have divided the generations in case of for the purpose of this study. However, we start about the effects of the pandemic on education. During the period, there was a lockdown, all schools were closed, but then we know that the human capital still has to be in place. So we look at whether the children have been engaged in any educational activity by age. And we found that virtually all the children reported being involved in some educational activity, but it is actually higher for children who are just completing senior high school at age 16, and those that are just completing the junior high school at age 12. And we also know that many children, maybe because the parents were also around, also engage in some educational activity. But this was probed further to look at what are the actually type of learning activities that were going on. We find out that only 2 activities were important. They said the children were studying on their own, which we feel may not be as optimal as they think, or that the parents were teaching them because they were also in lockdown. But after the lockdown, we know these ones will go down. But it also showed the fact that in case of readiness of a country like Nigeria for online teaching, that the other aspects are not so utilized. In the case of engagement with teacher, we realized that some teachers still visit the houses and some through the phone. We looked at the health implication and we found out that very many people were unable to access medical treatment during the period. And the question as to why that happened was not much about the pandemic, but was also as a result of poverty. More than 60% of the individuals couldn't access health care because of poverty. But the pandemic movement restriction also had an impact, especially for the elderly, where more than a quarter of the elderly reported that they were not able to access health care as a result of the pandemic. If you look at the effects generally on the cohorts, 76% of confirmed cases were between 20 and 60-year-old, and that's the working age. And that's going to affect the productivity and production. And there are also some associated costs with it, associated costs of mortality and of the morbidity associated with this type of illness. Then, concerning the employment and income, we found that close to half more than 57% of the elderly were not able to walk. And also it affected virtually all the generations. Inability to work during the period also affected the income that was earned. And it was not surprising that those within the working age, especially the male, close to 80% of them had their income reduced between mid-March and May 2020 in this period. And the lowest were the female, about 55 to 64. And you know that in Nigeria, the female labor force participation rate is actually low. So this is the effects that we see. During that period, we also identified two peculiar shocks. The first one is job loss, and the second one is the illness or death of the breadwinner. And we find out that for all the cohorts, more than about 17% of the total population reported that the breadwinner lost his or her job, and also about 15% at the breadwinner becoming ill or dying. So what was the response to some of these things that has happened during the, we divided them into three: food transfer, direct cash transfer, and other transfer. And by those who are giving it, whether it's government or private people or individual. But we find out that government is giving more of direct cash transfer, and the food transfer is given by other institutions. So we look at the coping strategies by individuals. So the shocks, and if you remember the two shocks, the job loss and illness and death of breadwinner. In case of job loss, savings is the main coping strategy. And the next most important ones is that they try to reduce their food and non-food consumption, as well as engage in additional income generating. In the case of illness or death of the breadwinner, there's a slightly change. Although savings is also used, but this time around familial transfer, especially borrowing and assistance from friends or family, were also used, in addition to the sales of the assets of the person who has died. This shows the differences that we think will go into analysis as we have more information from another survey that is being done. But generally, I conclude by saying that looking at this data, we find that the post-COVID era will be a time that people will now realize of how connected everyone is and every generation is. Although we found that children and early retirees are mostly affected. Coping strategies is usually savings and reduction for job loss. But this is different from what we have for illness, where savings and familial transfers are the most important. Moving forward, the pandemic has been able to develop from the result of the survey that there is a stronger sense of ownership and support among people, and as well as a strong sense of responsibility by every economic actor, family, governments, institutions, to be able to find a solution to this pandemic. And this calls for the following suggestion, that we need to build and strengthen the capacity of the population at all levels, and we need to develop economic and social resilience among individuals and households. This is the only way in which countries and individuals and households will be able to cope against a pandemic such as the COVID-19. Thank you very much for listening.
Thank you very much. Right on time. The next speaker is Dr. Valerio. Please, Dr. Valerio, the floor is yours.
Hello, everyone. Thank you, Miguel. It's an honor for me to be here. Let me make an important remark. I'm not a doctor, but I hope to be one day. So thank you, Miguel, for your help in preparing this presentation and for the encouragements during this stage. I still do not have any results to share with you, but more some general thoughts, some methodological thoughts, and let me share the screen with you. What I'm trying to do is to use the NTA results, which we tried to update for Moldova for the year 2018, and to combine these results with a CGE model, just as in case of Bangladesh, to understand better the intergenerational implications of the COVID-19 and of its economic fallout. Very briefly about the Very briefly about the contagion channels. In case of Moldova, they are quite special. While I think that there are some similarities with Bangladesh, of course, there is domestic shock which has been imposed by the confinement and social distancing measures. In result, a number of economic activities have been simply closed for many months already, for 3 months. Some still remain closed. And there are some external shocks which are very important in case of Moldova, which is very much dependent on foreign trade and on external economic conditions. First of all, there is, of course, all of us expected the fall of remittances. Especially, this channel can be very important in case of relatively young rural families, those having 1 up to 2 children. Most of these families, there are clear gender roles, with wives remaining home and husbands working in Italy or in Russia and sending back remittances. However, the data so far show an opposite trend of growing remittances month by month, which is quite surprising, quite intriguing, and I think that actually this is an indication of the fact that many migrants are coming back for good to Moldova, and they are bringing back their savings, which have been accumulated abroad. And we can see these savings reflected in statistics as remittances. Probably in a couple of months, the situation will be clearer. The second channel of contagion is fall in exports, especially in case of textiles and automotives. These are mainly urban-based industries, and some of these industries have clear gender profiles, like textiles employ mostly women, whereas automotive sector employs mostly men. And there is a third channel of contagion, which comes from readjustment of export and import prices, and there is a potential shock which may come from worsening terms of trade in case of Moldova. Of course, the government reacted with some immediate policy adjustments, but in general, these policy adjustments can be characterized as rather modest, which are determined by relatively limited resources which Moldovan government has at its disposal. Moldova is a relatively poor country with limited resources. Changes in VAT regime probably can be mentioned, and some increases in the unemployment support can be mentioned among the most important policy measures. However, we think that the economic crisis in this case may have significant implications for the intergenerational economy. And why? Because many economic activities vary significantly by age and sex of employed persons. For instance, in case of services, most affected sectors are these are the sectors which have been the most affected by administrative restrictions. Many of these sectors employ more of the urban younger population. Yeah. Whereas in case of the agricultural sector, this sector has not been affected directly by administrative restrictions, and this sector employs relatively more older generations. At the same time, as I already mentioned, the remittances may have age differentiated effect because they have a disproportionate higher role in budgets of the rural young families. The question is how to assess the impact. Just as in case of Bangladesh, we are going to use a computable general equilibrium model, and we are going to use the NTA age profiles for the calibration of the general equilibrium model. Initially, of course, we thought of an overlapping generations model, which would be a forward-looking dynamic model. However, we think that the computational difficulties involved by overlapping generations models probably do not pay off. And it's in this case, it's more indicated to have a simple static or dynamic, recursive dynamic CGE model, which would be better calibrated using NTA results. And we think that we can actually include a very detailed structure of the household sector, potentially up to 19 households, or actually 90 individual ages, which can be included in the model. The calibration of the model would rely on the structure of the income by age and by sex, the structure of expenditures by age and by sex, age and sex structure of the employed labor by sector. And we already know all these details by spending a lot of time in generating NTA for this year. Probably the most difficult task would be to calculate the so-called interinstitutional current transfer matrix. However, I think that there are solutions which can significantly ease this task. And as an alternative solution, we can aggregate the individual ages into bigger age groups. The next steps. Just a couple of days ago, I finished updating the NTA for Moldova for the year 2018. This update was very important because after 2014, the first year for which we produced NTA for Moldova, many methodological changes have been introduced in the national accounts, in national demographic data. So it was very important for us to update this. And our aim was actually to disaggregate it as much as possible by gender and by residence area. And I think I managed to reach relatively satisfactory results by when it comes to NTA disaggregated by gender. It was very difficult because I kept getting very surprising and contradictory results at first sight, and these figures show why I thought that these results are rather contradictory. As you can see, the life cycle in case of women is practically permanently negative. Of course, this result generated a lot of questions here in Moldova, and I spent a lot of time in reviewing this data, in going through my code in R, spending a lot of time in this, but I kept coming to the same results, to the same profiles. And looking from a purely economic perspective, actually, I can understand and fully explain why it is. First of all, there are very large, very significant differences between employment rates. In case of Moldova, of men, the employment rate is around from 6 to 7% larger than in case of women. In addition, there are very large gender pay gaps. Wage of men is around 18% larger than the wage of women. So I'll stop here, and I would like to mention that there is another potential venue which I realized a couple of days ago of how can we use CGE model and in combination with NTA. We actually can use the CGE model results without any NTA connection. Yeah, we can use only the macroeconomic results. We can use these results and go back to the data set to run some micro simulations, and then to use the results of micro simulations and then calculate the NTA again for the same year. Thank you very much. I will stop here. I hope I did not abuse the time.
The time was perfect. Thank you, Valerio. So we had 4 extremely good presentations, and now we have 2 also outstanding discussions. So Marcel Meret will start with the discussion.
Thank you very much, Miguel. To maintain the tradition of this virtual conference until the end, I have also a couple of slides. Okay, good. So the two papers I was asked to look more carefully are from Basil and Valeriu. So the two papers, what they try to do is to link NTAs that we all know with computable general equilibrium models. So this is something, of course, that we have to encourage and applaud. And this is important that models can talk to each other. Obviously, the two approaches have some advantages and disadvantages, and it would be nice if we can use more and more the two for some policy questions. What is interesting when we compare the two is that in one case, in the case of Basil, what they do is to use CGE as to feed the NTAs. And in the case of Valeriu, at least until this morning, the idea was to use the NTAs and to feed the CGE, especially for the calibration purpose. I think both are of course, useful and interesting. There are two approaches. And actually, Valeriu just mentioned in his last comments that he's thinking about the other way, so the Basil way, I would say. So let me start with the Basil paper and his co-author. So what they do, as I mentioned, they have already a CGE, and they somewhat simulate the impact of the COVID-19 on the economy. So remember the assumptions: some drop in exports, a fall in remittances, a lockdown during 8 weeks. And what you come up is, of course, you won't be surprised, is a drop in the growth rate by 1.5%, and of course, a reduction in household income. So they use that result and they feed the NTA profiles by introducing a reduction in labor income and consumption profiles, life cycle deficit, of course, increase. And they come up with that kind of a conclusion that, of course, there is pressure because of that on private transfer to children and elderly, but especially to children. And they call for increase in public transfer. So again, this is very interesting, and I think this is very valuable. But of course, it's complicated. This is certainly challenging. For instance, among the questions I have is that, of course, when we talk about the CGE model, it was unsure to me to what extent the CGE model used to feed the NTA have age-specific effects in that model. I know that in the presentation, Basil has mentioned that they have different types of households. But we're talking about households, not individuals, age individuals. So we have, there is a link to do that. I guess they did it, but I'm not sure exactly how they did it from the PowerPoint. The other thing that we have to think about is that, of course, the COVID-19, how this is interpreted by the economic agents. Is it considered to be a temporary shock or a permanent shock on the economy? And of course, depending how this is perceived, the reaction can be different. If it's considered to be a temporary shock, well, we may expect that, the economic agents, the households, they may try to use their asset or their savings to fund the temporary decline in their income. And of course, it's a permanent shock. It will be something else. As Basil is using a static model, that's not easy to take this into consideration, but this is something we have to keep in mind. In terms of the policy implication, they suggest, of course, that if the private transfer across different individuals among households remain constant or maintain the same pattern, of course, because of the decline in income and the increase in life cycle deficit, well, you would expect that you will need some public transfer to substitute for private transfer. And that makes sense. But again, this is based on the assumption that the pattern remains the same. But we can, for instance, we can imagine, if it's maybe possible, in Bangladesh, you know Bangladesh more than me, but if the middle age, for instance, are generous and they want to maintain not the pattern, but the level of private transfers to their children and to their elderly, then maybe the policy implication of that is not to introduce public transfer, but maybe to reduce taxation on the middle age. So they will be able, you know, to fund that. But in any case, this is a very exciting paper, exciting project, and I certainly encourage Basil and his co-author to continue on that on that project. The other paper by Valeriu. Valerie mentioned they don't have results yet, so they are thinking about the modeling strategy and everything. And I think it's important to take the time to think about this, because this is very, very, very important. As presented by Valeriu, the COVID impact is multidimensional. It does affect the economy from many perspectives and many avenues. So this is quite a challenge. So he has mentioned some of them. So the issue on the health, on economic activity, remittances, again, export and so on. There is also a government policy response on that and so on. And what they want to do, at least until now, is to update the NTA and to feed that in the CG model, to calibrate the CG model using the NTA aging profiles. My first reaction reading that is that was quite an ambitious project. It seems to me a lot of work will be required for that. So my main suggestions would be that to try to simplify as much as possible the CG model, in the sense that there are so many questions you want to respond to with respect to the COVID-19. I would select some of them, maybe the ones that interest you the most. And I will try to simplify the CG model. You mentioned at the end of your presentation that you were thinking about an overlapping generations model, but then you think that that it's maybe too demanding and so on. Obviously, I suggest maybe to think even further. A few things that we have to think about that is about the time horizon of your model, if it's a dynamic one. When we're talking about the COVID impact, maybe we're talking about months, not years, at least until now. So maybe you can move towards a model which is relatively more simple than the one you have in mind so far. Maybe 3 age group would be enough, 3 sectors, your open economy and so on. Of course, calibrating your labor and consumption profile using the NTA, but that would be already quite an achievement. And one of the things that seems to be difficult with respect to the COVID aspect, and this is true for both models, is that, of course, when talking about the COVID, we have to think about the healthcare. And of course, in both cases, ideally, we would like to modelize the health sector and also the health impact on individuals. But these are the things that we have to think about. And one of the questions that is very hard to respond to, and what the governments have to deal with, is to what extent you emphasize, you know, the health safety measure versus the economic activities, a trade-off between the two, right? And maybe that kind of model can be helpful for that, but it's probably very difficult to develop for sure. But again, I think Valeria is courageous, so I'm encouraged to pursue in that direction. Thank you.
Okay, thank you. I didn't want to stop because the comments were excellent. So the next discussion is Andy Mason. Please, Andy.
Good. So let me say, I was amazed at how nimble our researchers are, that in such a short period of time, you were able to put together models and conceptual ideas and even data about COVID-19. And I myself am just sitting here in shock, still wondering what's going to happen and how we might think about it. So I think, of these presentations as being kind of aspirational, of trying to lay the groundwork for how we should think about COVID-19 in an NTA context. So there are a lot of, I think, possible things we can do that would be very useful. So one advantage we have is that our approach is consistent with SNA. So we can build on existing or readily developed macro models. So two of the papers, they have macro models that they use. Are they the right ones? I'm not really sure. I can't comment on that. Maybe they are. I know the macro model I have been using is definitely not a good model for looking at the impact of COVID-19. But the nice thing is we don't have to use our own models. If you don't have a model, you can go out and get other people's analysis about what's going to happen especially to the primary sector, to what's going to happen to labor income and what's going to happen to asset income, and then kind of adjust that for some of the things that Marcel was talking about in his comments. So another good thing about NTA is it emphasizes important sectors that aren't typically emphasized in macroanalysis, but are very important in this crisis. And private family transfers come to mind as being one of those sectors. We have data on human capital sectors. Those are very important and emphasized in some of the papers, so that's great. I think the generational dimension is high profile in terms of people's thinking, but maybe not really in the analysis. So are children going to be adversely affected, or what's going to happen to seniors? So we can answer or try to answer questions that other people really aren't well equipped to answer. And then I think the other thing we can do is use NTA time series data as in a post-mortem. So as we know more about what happened during the crisis, as we estimate NTA profiles after the crisis is over, it will provide some very interesting research for the coming decades. Now, in my classes, I used to, after many years of experience, I decided to rely on my students to do evaluations instead of grade myself. So I just designed rubrics and said, here, look at these different issues and you decide on, how good your paper is. And so these are some of the things that I thought about. I think about this in terms of my own work, but also I thought about it in terms of the work being presented. So we have this comprehensive set of variables that describe the economy: consumption, labor, income, asset income. Well, you're all familiar with what they are. And so the first question that comes to mind in looking at these papers is, are these baseline values available? So I have the impression that they're not for many, at least for recent years, they're not for most of the countries. So I didn't see much about private transfers. I saw Basil talk about it, but I wasn't sure what he was basing that on. And I know that the Nigerian and the Senegal data, it shows consumption of labor income for recent years, but I don't think the reallocations are available for recent years. Now, one thing I want to say is that I've noticed that people always they don't estimate the reallocations much, and maybe that's because they can't estimate all of the reallocations. But you can estimate asset income, and that would provide very useful information. That's a readily easy thing to do. as compared, say, with private transfers. And then public transfers is something that people should be able to estimate, even if they don't have a full set of reallocations. So the next column in my rubric is, can the macro values be forecast? So as I said, I'm not sure that the models that I've worked with would be very appropriate for this. So if I were going to do this, say in the US, I would go look and see what people in the US are doing who are used to dealing with short-term kinds of issues. So I think anybody could do that, even if you don't have your own macro model to work with. And then the question that Marcel raised is, whether there's information about age and gender-specific effects. So we always hear, if we look at unemployment statistics, we know that children and maybe seniors tend to be affected more than prime age adults. So that would be one example, but there are surely a lot more, and it would be very helpful to have information about age and gender specific effects. Now, I put up this matrix not thinking that anyone would be able to fill the whole thing in. That would just be this is a wish list, what I would aspire to. And I think that looking at any elements of it can be very helpful. And so I would encourage people to really continue this research and for others to undertake it. Thank you.
Thank you, Andy. So I was posting, for instance, that I'm thinking that like a Blanchard type of model, but it's not Blanchard, so it's finite lifetime, but highly linear, and being able to use as much of NTA as possible and calculate impulse response function in order to see what will be the effects of different policies, or what if there is a decline in income, or mostly in income, but also in other transfer profiles. What I have seen so far in most of the presentations is that it's changing across the globe. So there is no single country that has done it right. There is no single country that is implementing exactly the same policy. So one of the strengths that I see in NTA is that we have a lot of country team experts, and we have our profiles and our expertise. And you will barely see these kind of characteristics in many other institutions around the world. So I don't know what is the opinion, what is your comments on this?
Well, I certainly agree with you, and I was also interested to see if I can do something on the COVID. And one of the reasons I haven't started anything yet, although I thought a lot about what would be the approach, is the fact that it takes time to do a good job, but governance wants response right away. So it's a bit. I'm afraid to arrive too late if it's with something interesting. But for sure, it's an interesting challenge.
I think there's going to be huge intergenerational consequences of COVID. We've seen in all these countries how the labor income of the young suffered during the financial crisis, while the old did very well. And I think not necessarily the disease hit the elderly very, very hard, but not so far anyway. It's about an order of magnitude less than the 1918 flu. But the fallout of our response to it in terms of the lockdowns and the slowing of economic activity all over the world, I think is going to hit the young quite hard, as well as the increase in the debt that we pass down to them. And so I think the the intergenerational consequences of this COVID epidemic could be absolutely massive. And I think that, but we won't know for, if you think about what data we need in order to assess that, we're going to need at least a year or two to get the surveys, and but I think it's a very interesting research question, and I commend the researchers for starting out so amazingly, astoundingly quickly, particularly by English standards.
Thank you, David. Ron, please.
Well, I agree completely with what David just said, but it also just occurred to me that we've seen over and over again in these presentations throughout the week that the elderly are doing better than other age groups economically in these crises, economic crises, and including the COVID economic crisis, I think. But now it occurs to me, yeah, but this is really true in societies that have strong public pensions. It's really the public pensions and maybe public health care that are creating this. But now we're looking at Lanre and Latif talking about Nigeria and Senegal. These are countries, I think, that have very weak public pension systems, and the elderly probably are relying to a greater extent on family transfers and transfers from people who may have lost jobs or who may have died. And it may just be a totally different story in other parts of the world than the ones that have strong pensions. And I would be very interested, and I think it's important to try to learn about that as well. Thank you.
Thank you, Ron. Any other comment? Professor Batrou?
I will take just 1 or 2 minutes, and thank you so much for all the comments and also the interest that you have shown into this one. I saw comments from Ron in the chat box also, and also comments from Marcel. I think, yes, I think we need to, look into how, normally in this CG or SAM model, we represent households. We don't represent individual in that way. So we need to think of, in this one, we have used 5 households basically based on age cohort, which is a new thing. Normally they don't do that. They do by socioeconomic classification, like rural, urban, employment category. But we have used like age 0 to 5, 6 to 9, 14 to 18, 19 to 64, and 65 plus. So trying to see from how this will be impacted at least at the household cohort level, and then try to link that with the NTA in that way. The other question in terms of the shocks, whether it's temporary shock or permanent shock, to my understanding, the population shock would be more permanent, like the fertility increase and other things that will be more permanent in that way. And also the nutrition impact will be more permanent and forward-looking. But I think the economic shock could be very temporary, like it could be, like 3 months, for 6 months in that way. The last issue was also interesting in terms of seeing that if the middle group actually gives more, resources to the overall life cycle deficit will not change, but there could be reallocation that way, and that may have some implication on the government policy. But that needs to be seen. We don't know. I don't know the answer. We can only assume different scenarios with respect to the transfer. With that, I like to thank everyone, also and Andy for his comments on, and I will see. I did not get everything fully with that one, but I will see and then come back. Possibly get back to all of you. Thank you.
Thank you. Any other of the authors, presenters?
Sorry. Thank you for the comment from Merit and Andy, and I think it's very useful for us. And I think that also in the case of Africa, in Senegal, for example, Senegal is one of the I think that's the first country which locked down all its activity at the start of the COVID in March. And then it's impact a lot of the economy. And after we at university and with the Ministry of Higher Education, we have a big problem to help the government who has who need some response. How do you do this? How do you do this? And then I think that it will be very important for this COVID to have a collaborative work, because the impact is very high, and what we see in, for example, in case of Senegal, I think that for the hypothesis, it's very important to have a team, the national team or a team from other sector of knowledge, and to share knowledge to help understand very well the impact. And there are tools, but some of the tools we have, and we know that they are not construct. They are not built to have the rapid response of a crisis like COVID. And that is very, I think that NTA can try, NTA team or NTA network can try to know how do you move to NTA time series, for example, which can give some information, quick response for policy making. Thank you.
Thank you, Valerio.
Okay, thank you very much. It's Larry. Sorry, just 1 minute. Let me use this opportunity to thank everyone for the comments and to thank Sankyop for challenging me to do this. The data that we have from Nigeria is very useful, and we still want to exploit, because the sampling design was matched with the data that the household data that we use in computing the 2016 NTA for Nigeria. So I'm sure by the time we are able to explore the data fully, we will be able to find a good estimate, like a counterfactual of what COVID has actually done to the household by age and by gender. So I thank everybody. Thank you very much.
Valerio.
Thank you. Actually, remarks of Professor Latif Dram were quite in line with what I wanted to say. I think that the crisis, this crisis, really raises the question of the relevance of our tools for policy analysis. However, this type of crisis, which is very aggressive, of higher magnitude and short in time, because most of the macroeconomic data, of course, rely on data of other dimension, time dimensions. So I take this as a generic question and as a generic point of reflection for myself. And of course, I want to thank all of you for your suggestions and questions. I don't have yet answers to these questions, but I take them as a serious material for thinking. Thank you.
Thank you. So I think that is the time for giving the word to Sang-Yon, and to thank everyone for the participation, the great discussion, and the great presentations.